Hi everybody, welcome to Patients with Special Challenges, Chapter 36. This is Jessica Medrano, the Program Director for EMS. We're going to go through just our introduction to patients with special challenges. One of the key factors here is to maintain communication and empathy when dealing with patients with special challenges. Oftentimes the family caregiver is the most knowledgeable, so please listen to what they have to say and make sure it's part of your assessment. Also remember that patients with special challenges have to manage this every single day, and so be sympathetic to that as well. We'll go through techniques in this lecture to help you maintain communication, because without adequate communication, if the patient does not feel they can communicate with you, you will not get a thorough assessment and not be able to treat whatever is going on. More people with chronic diseases now live at home. There have been improvements in medicine and technology to help family members care for these loved ones at home rather than having them stay in the hospital for an unknown amount of time. Many of these people depend on mechanical ventilation, intravenous pumps, and other devices that you likely are not familiar with. The caregiver typically is. Do not be distracted by the equipment and make sure that your focus is on assessing your patient. There are different types of disabilities, and it's important that you clarify and learn about each one. Developmental disability refers to an insufficient development of the brain, resulting in some level of dysfunction or impairment. This can include intellectual, hearing, or vision impairments. An intellectual disability results in the inability to learn and socially adopt at a normal developmental rate. So when asking questions of the caregiver or the patient, please ask, what is their medical history, what is their condition? Possible causes, this can be genetic, congenital infections, which means that either in the womb or shortly after birth, the patient underwent some type of infection that delayed their development. Malnutrition, environmental factors can cause disability. Fetal alcohol syndrome, traumatic brain injury, and poisoning are some possible causes of an intellectual disability. You will need to rely on patients and family members for information, but make sure that you are making eye contact and that you are caringly speaking to the patient who is undergoing your treatment. Just make sure that you're loud enough or that the family member is close enough to hear so that you're speaking to both of them. The patient may have difficulty adjusting to a change or a break in routine, or they may be fearful that they're going somewhere that is not comfortable for them. So make sure you're taking that into consideration. Patients with intellectual disabilities are susceptible to the same diseases as other patients. So that's our kind of starting point. You're going to go into different disabilities like autism, and congenital-based defects and things like that. Please pay attention to your PowerPoint and make sure that you email Mike with any questions that you may have. Thank you so much.